Knock, knock, Joe. My name's Samantha. I'm a Southwest Tech nursing student. I'm going to be starting your IV today. Is that okay? Can you tell me your name and date of birth, please? And do you have any allergies that I need to be aware of? Just sulfa? Okay, that's good. I'm going to wash my hands quick. Then I'm going to pull the curtain and provide privacy for the patient. I do not need any sort of PPE today because the patient is not on precautions. I'm just going to double check the doctor's order here. Yep, Joe, he does want an IV started today, so that's what we're going to be doing. First, I'm just going to check your site here, checking for signs of phlebitis. There is no red, warm areas. Does everything feel okay? Nothing's tender? Okay. And this IV was started yesterday, so it's good for 4 days, so we're okay there. The first thing I'm going to do is just check everything over here. My IV bag is intact along with my saline solution and my tubing. Everything looks good there. Okay, Joe, I'm going to grab my MAR quick. I'm just going to do a quick check here. Sodium chloride. Okay, that's my first check, and that matches the MAR there. Okay, Joe, this is going to be going at 100 milliliters per hour, which is 16.7 drops per minute, is what we're going to be setting that at today. Okay, I'm going to go ahead and perform a second check here with the MAR, just to make sure that we're doing this right. 1000 ml, 1000 ml. Saline flush, okay. And the 5 rights of drug administration are right patient, right drug, right dose, right route, right time, and right documentation. Okay, Joe, I'm going to check just one more time. 1000 ml, 1000 ml of sodium chloride, and the saline flush. Okay, so everything is matched up there, Joe. Everything looks good that way. Okay, and the integrity of my packages are all good. I'm going to start by opening up my tubing here. Before I do anything, I'm going to close all the clamps on my tubing so I'm not spraying the saline everywhere. Okay. All of that is closed and good. Then I'm going to start by taking the top off of our IV bag. So once I take the top off, this top part here is sterile. I'm not going to touch that at all. Same with the spike here. I'm going to go thumb to thumb while inserting this. Being very careful not to touch the spike or the inside of, or the top of the IV drip. Okay, that is inserted there. So now I'm going to go ahead and hang my IV bag up. What I want to do now is prime my tubing. So I'm going to find my ports here. I'm going to turn them upside down because I don't want any air in the ports. Making sure this is all nice. First thing I'm going to do, squeeze the tube here, filling that halfway full of liquid. Then I'm going to open the tubing. And it is dripping. I'm just going to tap this to make sure there are no air bubbles in my ports here. All the air is out of my tubing now, so I am going to go ahead and close this again. The tubing has been primed. Okay. Now I'm going to come over to the port on your arm. I'm going to wash the port for 30 seconds. Making sure that I get around and on top of the port. I'm not going to set this down now because I don't want it to get, I don't want it to touch anything else now because it is a clean surface. I'm going to go ahead and get my saline flush ready. I'm going to take the top off here, Being careful not to touch this now. I'm going to connect these two. Okay, and once that's connected, the first thing I'm going to do is I'm going to aspirate for blood. Just make sure I have this in the right spot. I have aspirated and there is blood. Now I'm going to slowly administer this flush. The push, 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 push and stop, push and stop. Okay, and I'm going to leave that right there. As I did that, I was checking for signs of infiltration. There's no cool, warm, swollen areas. I checked underneath the arm just to make sure that it's going into the vein, it's not going into the skin surrounding. Okay, so after that, this is still clean. Now, as soon as I take this cap off, I cannot touch the cap, it's sterile underneath here. So I'm going to be very careful to keep this in this without touching anything. And then I'm going to connect these two. And my IV is connected. Now what I'm going to do is I'm going to start my drip factor. So I want about 4 drips per 15 seconds. So I'm going to go ahead and I'm going to set that up. Okay, I can already tell that's a little fast, so I'm going to close it a little bit. Okay, and that's at 4 drips per 15 seconds, so about 16 drops per minute. After that, I want to label the IV, so I want to write down, the time, the date, and my initials, so everybody knows when this patient started this IV. Then I will label this. Okay. Okay, Joe, is there anything else I can do for you? I have time. Okay, sounds good, Joe. And then I would document.